Ladies and gentlemen, kindly take your seats, please. We're about to begin with the final plenary. Excellent. Thank you so much for joining us again this afternoon. I hope the past 2 days' deliberations have been fruitful and meaningful, and that you have come up with a communique that is certainly going to lead the way forward. So this final plenary, as we hit the final stretch, in essence is going to chart the way forward. We're going to hear from some of the key role players as we look at 2015 and beyond, and ensuring the health of women and children beyond that deadline of 2015. We're going to reflect on what has been learned and what needs to be done and by whom over the next few years. Let me just introduce some of the people who will be speaking to us in this final plenary. We'll be joined in a moment by Dr. Carol Presson. She, of course, is the Executive Director of PMNCH. We'll also hear from Dr. Ariel Pablos-Mendez, the Assistant Administrator for Global Health at the U.S. Agency for International Development, or USAID. We'll also hear from Mr. Miguel Vega Pestana, Vice President, Sustainability Strategy and Global Advocacy at Unilever. We'll also hear from Mr. Yemurai Nyoni, the Founding Director of the DOT Youth Organization. We'll also be joined by Professor Babatunde Osotomehin, the Executive Director at the United Nations Population Fund, Professor Nila Muluk, the Special Envoy of the President of the Republic of Indonesia on the Millennium Development Goals. Also be joined by Professor Onyebuchi Chukwu, the Minister of Health in the Republic of Nigeria, and also by Dr. Flavia Bostrio, the Assistant Director General of Family, Women's and Community Health at the World Health Organization. And finally, we'll hear from Dr. Aaron Motsoaledi, the Minister of Health in the Republic of South Africa. First off, I'd like to introduce Dr. Carol Presson, who's going to reflect for us on the final communique of the Partners Forum. A warm round of applause for her, please.
Thank you. It's clearly a journalistic skill not to feel lonely and exposed when you're up here, which is how I feel at the moment. But, okay. Excellencies, honourable ministers, distinguished guests, colleagues and friends, and especially our youth participants, who I hope are still here, who are also distinguished colleagues but might soon be ministers. As our third Partners Forum comes to an end, I want to reflect on 3 main points: what we've been doing here for the last 2 days, and in the lead up to it, more importantly, to mention some points from the communique, and to express our sincere thanks for the tremendous commitment from everyone here, and indeed millions who are not here, which you'll hear about. We arrived here, about 1,200 of us from 60 or more countries, the first time in 4 years that our 7 constituency groups have met on a large scale since India kindly hosted the forum 4 years ago. Uniquely, this forum included the 60 to 80 youth advocates who've developed a youth outcome document. What has also been unique is that we co-hosted this forum together as 5 partners. Of course, the Government of South Africa, our gracious hosts, Countdown to 2015, the Independent Expert Review Group, A Promise Renewed, and of course PMNCH. The timing has been essential for our collective drive in the last 550 days, and as the post-2015 negotiations reach a really critical point. It's been an extraordinary few months for women's and children's health. We've seen the Toronto Summit, where Canada pledged $3.5 billion, the Acting on the Call event in Washington, and now Johannesburg. There's no doubt is fresh momentum for our work. We've also heard about very large domestic and other international commitments, like the one from Norway today, to forge even stronger links between health and education, and to quote, to do this swiftly, smartly, and jointly. Finally, we've launched some important reports. The Every Newborn Action Plan saw 40 commitments, including another today from Norway on Survive and Thrive, the Countdown to 2015 report, and the Success Factors report. And we had several ministers join us to talk to that. Through the Success Factors report and at the forum, we saw highlighted the importance of working in sectors beyond health, and I would like to quote Minister Tedros, "Girls' education remains the strongest method of family planning, and our health facilities will only be as strong as the road that leads people there." In the past 2 days, your voices, your data, and I like the term factivists, I think it was Bono who said that, and your commitments are being heard here in Johannesburg and around the world. We've had media coverage from all over: CNN, The Guardian, The Hindu, The Citizen, Tanzania, Daily Star, Bangladesh, Estado de Sao Paulo, everywhere. We also use the power of digital engagement. I think having the youth here really helped, because I don't know about you, but I can't even tweet. But we've had a PMNCH Live, which is our daily e-newsletter. It was received by 40,000 people. We had the Social Good Summit yesterday, and I don't know who else might have been there, but I was literally moved to tears several times. I was quite glad I was sitting in the back of the room. But what moved me to other tears was that the women and girls who spoke had really risen up. They'd got above these desperate circumstances in their lives, and they came out of it stronger. And here in Johannesburg, we hit the mark of, get this, 250 million Twitter impressions for every newborn, and that's just since last month. On to the communique, and I know there's been some lively debate about this. We must work together, use our voices to ensure that women and girls are at the centre. Investment not only helps us realise these rights at the highest level, but as we've heard several times, we can increase the investment from $1 to 9 in returns. I mean, that is, I think I quote Larry Summers here, if there were any other investment short of Facebook in the early days, you would be doing it without question. Ban Ki-moon said it best. He reminded us that success beyond 2015 depends on us working together and forging partnerships. I'll highlight a few points from the communique. You've all had it, so you can read, and to also say that the wording, sometimes the editing is not always great, but we can correct it. The communique is a product of a lot of hard work by many of you, many not here. Earlier today at the MDG Advocates session, the Forum communique reaffirmed that the health of women, newborns, children and adolescents is a human right. Bono said it's not fate, it's a choice. People have inalienable rights and we cannot deny them. It's not an option. It outlines our priorities for collective action to accelerate progress, and it endorses a standalone goal that maximizes health, access and well-being, ends preventable mortality and morbidity, meets individual demand for sexual and reproductive health and reproductive rights, including access to family planning. It endorses strong, ambitious and measurable global targets to save lives, specifically on child mortality, 25 or fewer deaths per 1,000 live births, newborn mortality dramatically reduced to 12 or fewer, and stillbirths need to be counted and prevented. On maternal mortality, we'll strive to ensure that there are no more than 70 deaths per 100,000. Now, this is language that technocrats understand. I think the job of us all in this room is to translate into what does that really mean? What is your lifetime risk of dying as a woman? If you're in some countries, it's 1 in 31. If you're in others, it's 1 in 4,600. We have got to really reduce that gap. And apart from the maternal mortality target, we must remember we had target 5B, which we really must protect, if not improve on, to achieve universal access to reproductive health, with, amongst other sub-targets, a minimum of 75% of demand for contraception to be met by modern method. And what I think we haven't yet got to grips with, setting a target for reducing the proportion of adolescents who give birth each year. And I haven't said the goods word, apologies to everyone, but I will. But on the child marriage, children marrying children, let alone marrying the elderly, is an outrage. Children having children is a tragedy. Apart from robbing them of their childhood and rights, their lives are at risk. And I think I would really like to see through this communique and everything else we can do in international fora, that really gets embedded, not mainstreamed out of existence, really embedded in the goals. The communique also highlights what are called the hotspots, and to quote Mrs. Michel, investing in poor and marginalised populations. No one should be left behind. We must commit to these high-impact interventions, good governance and leadership. We were also reminded yesterday that what gets measured gets done. We must commit to reviewing our progress. Before I conclude, I must give thanks to an incredible group of people who made this forum a success. I decided fairly explicitly not to name names, because once you start naming names, you inevitably leave people out. There might be one or two. But first, to our host, the Government of South Africa. Nyaboga, India Bulela, Obrigada, Mrs. Michel. You've welcomed us with open arms, and we're extremely grateful. The amount of work you and your staff have put into this, I think no one knows apart from you, but we've got a pretty good sense of it. To all the ministers, prime ministers, royalty, I put archbishops, I think there was only one, but you never know. Experts who lent their voices and expertise to our panels and plenaries and receptions. We're really inspired by your vision and commitment. In fact, we're not just inspired, I was completely starstruck and overawed, but anyway. To our international partners, heads of agencies, we're empowered by your leadership and commitment to the promise of a stable, secure world. To the forum co-hosts, and they know who they are, your continuing guidance, insight and expertise made this convening moment a watershed moment for us. To the PMNCH staff and board and partners, and particularly our inspiring board chair, Mrs. Michel, even in these last 2 days, it's clear to all of us that you will take the cause of women and children and PMNCH to new heights. Without your endless effort, ongoing guidance and dedication, this forum would not have been possible. And we'd also like to welcome Mr. C.K. Mishra, our new co-chair from India. I've been humbled and privileged to have felt the energy at this venue. The stories have moved me. Been inspired by your leadership and your dancing skills and motivation to engage and learn. We truly can achieve these ambitious goals if we continue to work together. In the words of Mrs. Michel, we must do more and we must do better. We must push and then push some more. As a midwife, this always has certain connotations. I think commit to deliver and commit to deliver, as we mentioned yesterday. Every day counts, every action counts, and every life counts. And when we care enough to act together, we can achieve greater results and better impact. It's a social pact to save every single possible life in every single country. No one should be left behind. Until our next meeting, I wish you safe travels, good health. Thank you.
Thank you so much, Dr. Presson, and Siyabonga Kue as well, on behalf of us here in South Africa. It's clear from the report that you've tabled to us here, just highlighting what is in that final communique, that it is indeed a strong rallying call to ensure that all of us here do ensure that maintaining the health and development of women and children is a priority for all of us from 2015 and beyond. Thank you so much once again. Well, our next speaker will be Dr. Ariel Pablos Mendez. He's the Assistant Administrator for Global Health at USAID. Now, Dr. Pablos Mendez, before you make your way up, let's put this question to you as a way of throwing to what you will speak to. We know that the last mile is always the hardest. So what will it take for us to reach the final hurdle in these next 500 days? A round of applause for him, please.
Thank you very much. Thank you very much. And I'm an optimist, so I believe the answer to the question is we just keep pushing and pushing because we're going to get there. I would like to start thanking you, Nikiwe, for moderating this panel. I'm really, on behalf of my colleagues at USAID and my own, let me start by expressing my deepest appreciation to Mrs. Gracia Machel for her support and tireless efforts on behalf of women and children around the world and in Africa, and including as an ambassador of A Promise Renewed, and also for being such an enduring source of inspiration for all of us. Muito obrigado. And a special thanks also to the partnership. Thank you, Carol, for your steadfast leadership, and for, yes, go for it. It's been a lot of work. But it's been a success, and congratulations for that. I also join Carol in thanking the government of South Africa, and both as a co-host but also as a leader in the health field in Africa and around the world. And I'm pleased to be part. Yes. And I'm really pleased to join such a distinguished series of speakers in this closing plenary. We are at a turning point in the history of our civilization, and it's health that is driving an incredible change, a gift for our civilization, for our times. Paraphrasing Dickens, these are, without a doubt, the best of times for maternal and child health. But we have to get better. More than 100 million lives spared in the last 20 years alone. And that now gives us the energy, the belief that we can indeed achieve very much bold end games in global health. It sort of built up as a drumbeat in the last couple of years. In 2010, was pivotal for women's and children's health with both the Partnerships Forum in New Delhi, but also the G8 Muskoka initiative, and then, of course, the Secretary General, Every Woman, Every Child movement that provided a framework for many of the historical pieces that have been coming together and really driving an incredible, unprecedented momentum. As someone who has been in global health for the last 25 years, we have not seen this before. Among those, an example has been the United States with the governments of Ethiopia and India in collaboration with UNICEF, held the Child Survival Call to Action 2 years ago, that spawned a Promise Renewed, and put together a vision for a grand convergence in life expectancy between poor and rich nations, because saving children is statistically the best ways to increase life expectancy in the world. That same year, we saw the launch of the Family Planning 2020 and the UN Commission of Life-Saving Commodities for Women and Children. The UK followed with the Summit on Nutrition. It's been really an incredible time. And this year, just since May, we have seen the global health community again coming together behind this agenda. So it made us very optimistic. We certainly will reach the last mile. We have accelerated. As we approach the last mile, we're not slowing down. We are accelerating the rate of reduction of maternal and child mortality. Following the World Health Assembly, in May, the Prime Minister Stephen Harper of Canada hosted a summit on maternal, newborn, and child health. And again, many of the critical issues were put on the table, and particularly appreciation for the leadership in nutrition and building new partnerships with the private sector, and importantly, measurement, registering every life and every event. And just last week, many of us were in Washington attending Acting on the Call, Ending Preventable Child and Maternal Deaths, hosted by USAID, UNICEF, the Bill and Melinda Gates, again with the governments of Ethiopia and in India, to celebrate progress, assess the challenges that remain, and identify steps to sustain this momentum in the future. There's plenty of good things happening right now. The forum places a special focus on the 24 countries that account for 70% of the under 5 and maternal deaths, and we have put that in a report with UNICEF and UNFPA last week. We also announced a vision to end preventable maternal mortality, and as we heard from Carol, by 2030 we are aiming at the world being under 70 per thousand, or in other words, the lifetime risk of a woman dying from pregnancy to delivery being less than 1 in 500, which is approximately what OECD countries enjoy today. That is possible, and we are on our way. We are 70–80% of our way there. And here we are now with the third Partners Forum, which has provided an excellent opportunity to deliberate further. We have heard about the Every Newborn Action Plan and many of the other important reports. So we are, I think, in very good shape as a community as we enter the post-2015 goals deliberations. And we have also now, here from the UK Government Global Summit to End Sexual Violence and Conflict, the Girls Summit. So a lot of forces conspiring for our success. And I think that we are going to make the best of this, because in the end, as we heard from many others, it has to happen in countries, it has to happen in communities. Resources are growing, 17.5% increase, even though global health budgets have been flat. More importantly, the governments of the countries themselves are increasing the commitments, and that's the way of the future. As a global community, we will have to rethink the financing of the end of preventable child and maternal deaths as part of the post-2015 agenda, with a different outlook than we had before. And I would like to close also with something very close and dear to my heart: measurement. Measurement has been key to the success we just reported in global health. And we didn't have this 50 years ago, but we started in the family planning space, we added child survival, and now we have demographic health service. We just entered the 7th edition. Over the next 5 years, another 80 countries will be doing surveys. We have just announced also the new version of the measurement award that allow us to help countries build capacity across the various dimensions of their health systems. We need to make sure that we get subnational data. Maternal mortality is bad, but it's now becoming statistically hard to measure. And so we need to find new ways with technologies and with management systems to ensure that every woman is kept alive and that every death is recorded and analyzed. And we are now working with WHO and working with the World Bank and other partners, looking to a measurement summit early next year that will allow us to position the various dimensions of measurement and accountability in the post-2015. So I'm very much optimistic that working together, we can go past the last mile and deliver for our civilization a historical accomplishment. Our generation will end preventable child and maternal death. Let's go and do it. Thank you very much.
Thank you so much, Dr. Pablos Mendes. And it's clear from that kind of optimism and commitment that certainly we'll be able to reach the goals that we have set for ourselves. Let's hear now from Mr. Miguel Vega Pastana, the Vice President, Sustainability, Strategy and Global Advocacy at Unilever. Now, throughout the duration of this forum, we've heard about the importance of multi-sector approaches. In fact, in the previous panel, I heard one of the panelists saying that he disliked that term. It's such an ugly form of jargon. But the fact is, multi-sector approaches are important. As a representative of the private sector, what does that mean for you?
Thank you very much. That introduction just about filled the space for me walking around the front of the desk here. So I really do appreciate this opportunity to be with you today and to close this session. It's for me been a really enriching process. I think we've hugely benefited from all the insight and the learning that we've had together over the last 2 days. And I'm really glad to see so many of you still here for the closing session, which is a real sign of commitment as well. I was actually told by my boss that the role of a closing speaker is to ensure that you end on a high, that you build momentum and energize, and that you ensure that you always have a clear call for action at the end. So no pressure there then, and I hope that we will do that. So I'm here, as has been said, as a representative of the private sector, and really what we've been trying to do over the course of the last 2 days is underpin the fact that we are a partner in helping to find solutions to these systemic issues that really undermine both child and maternal health. So Unilever as a company, for example, we've set ourselves the challenging task of reaching 1 billion people with improvements in nutrition, access to clean water, and improvement in basic sanitation and hygiene. And we not only believe that this will actually help us build a more sustainable and resilient business, but it's also going to contribute to the needs of the 4 or 5 billion consumers who use our products around the world each day. But we know that the solutions, and everybody's been touching on this in all the panel sessions that I participated in, that these solutions are integrated and holistic. Our emphasis is to really to address the challenges of water, sanitation and hygiene, particularly hygiene through hand washing with soap. And why? Well, because we know that it's the lack of access to basic sanitation which is responsible for more than 88% of child deaths that are related to diarrheal diseases. And also, these are drivers of stunting and of malnutrition. We know that there is a big impact on gender and on education and ultimately on the economic performance of many countries. Diarrhea, for example, itself contributes to 272 million lost school days each year. Yet, the simple act of hand washing with soap at specific and key moments in each day can actually reduce those risks by 47% and the risks of pneumonia by 23%. So what is it that we as business can do to play our part? Well, I think the first thing we can bring is we have a lot of experience in behavioural change and in how we can drive a behavioural change. If you look around, for example, 90% of homes in India have access to soap. It's not that soap isn't available. The fact is that people aren't using it properly. They're not using it in those 5 key moments of the day when they need to wash their hands with soap. We also know that we build toilets. We've built many, many toilets. But actually, experience has shown that we don't have these sustainable systems, so we end up with toilets that are not clean and often fall into disrepair and into disuse. And a lot of that is about how we ingrain behavioural change. We can also bring innovative products and services to the market. So, for example, one of our brands that we've recently launched is something called Lifebuoy Green Germ technology. And what that does is it's essentially a soap bar that stays green when you wash your hands for 10 seconds or more, and then the color changes. And this incentivizes young children to actually wash their hands for a sufficient amount of time to have the beneficial hygiene effects that we're looking for. It's also about helping to create new entrepreneurial models, ways that can actually build resilient systems, because we've heard a lot about the fact that we need to build resilience when we design these models. We, for example, have been partnering in developing something called the Uniloo, which I won't say is Unilever, but Uniloo, which is a partnership we've been doing, for example, in Ghana, which is a model that works around building a social enterprise scheme for many people to actually develop not only technology in terms of basic sanitation, but also creating a downstream market for providing commercial benefits in agriculture for the outputs. We can also connect with consumers. We have a lot of access to consumers and a lot of expertise. So again, for example, we've just done a major program with UNICEF, with one of our brands, Domestos, and that's actually benefited 1 million people in the course of 1 year who are now living in defecation-free communities as a result of those interventions. So what we also need to do, and we recognize, is that we need to move and break from what I call the cycle of pilotatitis, and actually move to what we see as scalable, replicable, and sustainable models. And that actually does mean making commitments to deliver at scale. So in our case, for example, we've just committed to trying to ensure that at least 500,000 women will benefit from neonatal hand-washing programs that we'll be rolling out in at least 7 countries over the course of the next 2 to 3 years. So I'm really pleased to see that there's a strong effort, I'd like to acknowledge the work that both WHO and UNICEF has done in leading other organizations to enshrine the WASH agenda in the post-2015 agenda. But I have one plea, and that is that we still need an indicator for hand washing with soap, because that's actually still missing from that framework. So I'm going to end with using a well-worn and well-used African proverb, but I still think it's one that holds very true. And that is to say that if you want to go fast, you walk alone. But if you want to go far, you walk together. And where we stand here, we're standing here committed to walking hand in hand with you on that journey. Thank you very much.
Thank you so much, Mr. Vega-Pestana, by indeed once again highlighting for us the important roles played by everyone if we are to achieve what we've set out for ourselves. We also, throughout this forum, have heard about the important role to be played by young people. We heard Dr. Chang saying that they must now take charge. They must take the lead. So let's hear from them now. I'd like to invite Mr. Yemurai Nyoni, the founding director of the Dot Youth organization. And really, Yemurai, the question to you is simple. What role are young people going to play in helping us achieve these goals?
Beat that. All right, my name is Yemurai Nyoni, and the task that I have today is not a very simple one, because I've been tasked to, throughout this forum, to listen to what fellow youth had to say, and to try as much as possible to speak in a way that reflects what we've been saying as young people. And just one statement, we haven't just been here to listen to what you've had to say, but we've been here to also help direct your efforts, right? We've heard about the proportion of young people within the population, but also I come from a constituency of youth who are actively taking action in their different countries to advance maternal and newborn child health within their different countries. I, for one, am carrying out a project to end child marriage. Young people are mobilizing fellow youth to take up contraceptives. Youth are engaging with governments to change laws, to influence policy. So we are also partners within this agenda. And in that regard, I just want to appreciate that finally the PMNCH has agreed to bring young people on board. Third time lucky. And I think we just need to give them a hand to appreciate their courage. So they've opened the door for us, and our request is, can you keep the door open? And if you keep it open long enough, next thing will require a room. Yeah, because we're in this together. We're in this together. Well, I've been asked to speak about how best you can reach out to every woman and every child. And my answer and our answer to this is, we must reach out to every adolescent. We must reach out to every adolescent. So I want to just give some images which can help you think through what we've been trying to say. The first one is this one. I'm not sure if the camera can catch this. Oh, cool. All right, so what you have here are what I tried to put as young people. Different sizes, located in different places, some darker, some lighter. But essentially, this is who we are. We're different subgroups found in different places with different needs, different locations. What often happens is sometimes we reach out to the bigger dots, the dots that are easier to see, the dots that are easier to reach, and we miss out on the smaller dots that actually create the perfect and clearer picture of what it means to be young. So if we are really going to make sure we reach out to every adolescent, we first have to make sure we connect the dots. We must connect the dots. Every young person counts. If we really want to reach out to every woman and every child, change should not start from the top going down, but it should start from how we reach out to the most marginalized adolescent moving up. I believe this is the time for us to be optimistic. We've gone through a 15-year period of looking at how we can make development happen. We've seen what has worked and what has not worked. And I think we should really be looking at how best we can increase the energy around reaching out to every adolescent. So our message to you is, let's amplify the dot. Let's amplify the dot. And what basically we mean is, most times we look at the proportions of change. We're going to reduce maternal mortality by 50% or by 30%. We're going to reach out to 10%. But in essence, we are not interested in proportions. We're interested in what you do for the numbers, for the individual youth who need the services that are able to save their lives. So whilst one is 1% of 100, one is also 100% of one. Another message that has come out clearly is that you need young people to be able to reach out to young people. I said this earlier, that we are already active stakeholders. We're doing a lot of work in the field. But essentially, in order for you to create programs that can reach out to young people, you need to understand what we want as young people and how we want it. What types of condoms do we want? Where do we want them? What types of messages do we want? How do you best reach out to us, and how do you create those messages so that we are able to receive them? At the same time, we've also been pushing and saying we want to also be able to provide these services to each other as young people. There are great examples. For example, we have the One Love Foundation here in South Africa. They have different peer educators that they're engaging. I have interfaced with an organization called AfriCaid in Zimbabwe that engages adolescents living with HIV to provide counseling to fellow adolescents living with HIV. I think we should go beyond the idea of making sure that we keep your job safe and make sure that we do what needs to be done to get the services direct to young people. I want a service that's provided by a person who is the same age, similar experiences, who probably is just better equipped to meet my needs. Also, we've been calling and are calling on you to empower us to engage our governments on the commitments that they have made to also change policy and better inform the post-2015 development agenda. Simply, what I will say is, we as young people are at the heart of the post-2015 development agenda. The reason why I'm saying that is between now and the next 15 years, we will be the mothers and fathers whose lives and health you need to protect. You need to worry about what has to do with perhaps the aging and how we make sure we take good care of you. That's the honest truth. Yeah, so in simple terms, 15 years from now, you will no longer be of reproductive age. The 25-year-old now will be 40 years old in 15 years. Right? The 15-year-old will be 30. The 10-year-old will be 25. So this should shape the discussions around the post-2015 development agenda. And so we're encouraging you first to build on human rights. You must make sure that whatever is discussed in the post-2015 agenda is centered on human rights, protects the rights and privileges of individuals and our ability to exist safely in the space that we deserve. And this includes protecting us from gender-based violence, making sure that child marriage does not go beyond this year or is not part of the next 15 years. At the same time, you must make sure that comprehensive sexuality education is provided without exception. You see, comprehensive sexuality education is an identity issue. It's about me knowing who I am. It's the same thing as a birth certificate or an ID. It's a basic issue of making sure I understand my body, I understand what I'm able to do, I understand the risks associated with the environment I'm in, I understand how I can make sure that I'm healthy, safe, and protected, and I believe that's how we should approach it. We must not take information away from young people or keep information away from young people. That makes sure we're able to identify who we are, understand who we are, and be better equipped to contribute positively to, in terms of our own lives and also the world. We also need to make sure that youth employment is prioritized. We have discussions now about how women are disenfranchised and are not given or are not able to discuss and negotiate for safer sex, are not able to access contraception, are not able to actually go and access maternal health care. The women today are not able to do that. And the women tomorrow will not be able to do that if we don't make sure that youth employment is a priority in the post-2015 agenda today. We must equip young women and young men to be able to take care of their own health in future. And linked to that is the issue of education. Must make sure that education is prioritized for both young men and young women. And this education should include education for young men on how they can protect, fulfill, respect the rights of women. And this education must make sure that, for example, secondary education is prioritized for young women as an entry point for employment. Well, without taking too much time, and because I lost some energy when I jumped over this platform, so I need to be sitting down soon, we just want to say we are here to work with you and help make this happen. During the last few days, we've basically been discussing how we can get our hands dirty, make sure that we engage governments, work with them, and get our priorities put up in the post-2015 agenda. And in order for us to be helped to do that, we need to officially become a youth constituency of the PMNCH forum. Not just for now, but perhaps for the next 15 years and further. All right. We also encourage you to help us push our agenda. Back there in our countries, when we discuss with governments, when we want to engage fellow youth, we'll need the resources, we'll need the political space, we'll need your capacity as civil society organizations, we need to understand from your experiences. So please connect with us back home and help us be able to bring the change that we need to make. So if someone were to ask you what you learned from this forum and what you took home, please let it be that you need to invest in youth because youth really are what we are talking about in the post-2015 agenda. Thank you very much.
Thank you so much, Yemurai. The message was heard loud and clear. Young people want to be involved and take action. Thank you so much. And with young leaders like yourself, we're certainly inspired by the work that you're doing. Yamarai, thank you so much for that. Well, last week, UNFPA and other partners, later this week, I beg your pardon, the UNFPA and other partners will launch a roadmap for change to accelerate our progress toward MDG 5 on maternal health, linking to newborn health. And I'd like to invite Professor Babatunde Osotomihin, the Executive Director of the United Nations Population Fund, to come on stage and give us a preview of this roadmap. And don't worry, Professor, no one expects you to jump on stage. Okay, thank you.
Don't worry, you could never tempt me to do that as well. And let me congratulate my young friend for exciting the audience and actually making his point very clear. And before I go to my speech, I'm going to also say something about what he has said and to correct some inaccuracies. You know, when you talk about 15 years from now or something, some of us will not be of reproductive age. I think you need to correct that. Because the men here will still be able to reproduce. The other thing that I think you need to take away from here is that I like the idea that you are jumping. 15 years from now, you will not be able to jump. And you will be an adult. And so you are asking for a door to be opened for you so that you can be part of PMNCH. But truly, you also must have a succession plan to make sure that as you reach adulthood, there are other young people who will come with you. And I think that's an important message. Because at some point I was president of the African Medical Students Association, and I was all over the place saying the same things. But suddenly, I'm old. Now, I have two tasks, and I think the first I'm going to do is, and I hope I still have it, yes. One of the daughters, distinguished daughters of this land, who currently is the executive director of UN Women, has asked me to read a statement to this meeting. And I'm just going to do that. It's a very short statement. Now, you'll pardon me because I might not pronounce this very well. Sanibonani Ikaya. I bring greetings from myself and UN Women to all you partners in maternal, newborn, and child health. I also greet the hosts of South Africa who I know will provide an enabling environment for this important event. UN Women is proud to be a partner of the H4 Plus and the UN Secretary General's strategy for women's and children's health. The time we have before the end of the MDGs is precious, as many countries can still intensify delivery on the goals affecting maternal health and child health. One child saved, one woman saved counts. Saving lives of women and children is a task for all men and women. And I think Princess Sarah did say yesterday when we did talked about babies as well, because I think we must not forget. We must use the lessons learned from the MDGs to chart the new post-2015 development agenda. We know that women's health must be addressed in a comprehensive manner across a woman's lifespan. Health services should be integrated, and human rights must be guaranteed. The status of women's health is often an indicator of the status of women in society, and indeed, I think is the status of the health of a society. All the goals in UN Women's Strategic Plan, from increasing leadership and economic empowerment to ending violence against women to gender budgeting, make a strong contribution to women and children's health and well-being. Let us capitalize on the countries of this forum to raise our voices for human rights, to challenge the norms that drive inequality and discrimination, and to develop innovative strategies to tackle the root causes of poor health outcomes. As we push to achieve the Millennium Development Goals, chart the post-2015 development agenda, and commemorate the 20th anniversary of Beijing's Women's Conference, we have an opportunity to place women's rights, women's empowerment, and gender equality at the center of the global agenda. Ending gender inequality by 2030 and achieving the future we want for girls and women has to be a mission of our time. I thank you, and I look forward to continuing partnership. Onward. Now, I was asked to talk about what we are actually going to do in Kigali on the 3rd of July, 2 days from now. On the 3rd of July, UNFPA, on behalf of the H4 Plus partnership, and I think I should expand it for you, those who might not know, the H4 Plus partnership in the United Nations is UNFPA, UNICEF, WHO, the World Bank, UN Women has joined, UNAIDS, and it's more than 4. That's why we put the plus, so that we can have many more people join us, because we believe that as many of us as can work together for women and children's health will be important. So on behalf of this partnership, we are launching a roadmap to accelerate achievement of the MDGs 5A and B and 4 in Kigali, together with the MDG health advocates. Now, this would happen on the 3rd of July. And with less than 500 days remaining until the MDGs deadline, we need to accelerate action and scale up investments towards 5A and B and 4, which we must underscore and emphasize, include universal access to reproductive health. I think also it's important for me to basically remind all of us, because I think it's something we tend to forget many times, that when you look at the construction of the MDGs in 2000, it had a 5, and the 5 spoke to maternal mortality. But it didn't speak to how we're going to reduce maternal mortality. So we had to fight for 7 years, 6, 7 years, to be able to get universal access to sexual and reproductive health services, which included family planning. For some reason, the world doesn't want to talk about family planning. But I think that we must resist that going forward. Family planning, the access to sexual and reproductive health services, and the rights of women and girls to this must be center to what we do going forward. Now, we've made progress. And needless to say, that progress in numbers, and we can cite those numbers. But the thing about it is progress is not enough. No woman should die giving life, and no woman should be denied access to family planning, because it goes far beyond the ability to space your children. It is also gives you the liberty to control your fertility and your life, so that you can decide what you want to do with yourself. So for MDG 5 Target A, which says a 3/4 reduction in terms of what we were doing, we have actually, we've done very well, less than, with about 50% reduction in maternal mortality. The global maternal mortality rate in 2013 was 210 maternal deaths by 100,000 live births, and that, I think, is down from 380 maternal deaths per 100,000 live births in 1990. For the target B, the MDG target B, the late coma target, which we call it, promises a major stride towards the promise of universal access to reproductive health services worldwide. Worldwide, contraceptive prevalence has increased from 54.8% to 63.3% in 2010. But unmet need for family planning has also decreased from 15.4% to 12.3%. However, we still have more than 200 million women in the world today who want family planning and are not getting it. And so we think that it's not, the progress is not rapid enough, and we need to do everything in all regions of the world and in all locations, because many times we talk about averages. Averages are not good enough. Everybody must count, and everybody must be included. Sub-Saharan Africa still carries the high burden of child and maternal deaths and the unmet need for family planning. If we were to achieve the MDGs, we must scale up the interventions that we know can save the lives of additional 139,000 women and 250,000 newborns in 2015, above and beyond the current trajectory. The roadmap we're going to launch sets out integrated interventions across the spectrum of reproductive health, including maternal health and contraception, and invites the international community to mobilize support to intensify investment, financial, material, and human in these proven solutions. So we know what to do. It's just about getting to do it, and this is something we're going to do with countries and make sure that it happens. Accelerative interventions, that is, strengthen critical health systems by improving access to quality and integrated health education. And I would go beyond that and say, and support my young friend and talk about comprehensive sexuality education, because I think that's important. Information and access to information, access to services and commodities, including the training of key workforce such as midwives and health workers. Sometimes midwives don't come into service as frequently as we want it. And Ethiopia has shown us quite clearly that we can actually do this in a more rapid way. And that has reduced maternal mortality considerably in that country. And I think we also must include the interventions of the 13 life-saving commodities, which was addressed by the United Nations Commission on Life-Saving Commodities for Women and Children. I just got an email from a colleague of mine. I'm very excited about it, about the work he's doing in northeast Nigeria, where, in point of fact, they're using misoprostol and chlorhexidine to reduce mortality of women and children in there. And they have now been able to get all of the states of Nigeria except 11. So that means they have 25 of them who are bought into this. And they are the ones buying the commodities themselves. So we can do this because they're cheap and they're easy to apply. And I think that the UN Commodities Commission actually did say that. They expand access to services and commodities and easier to reach populations. Already have enhanced access to services. So we need to accelerate our interventions and focus on those we are not able to reach and who because of the way we have planned our health services, we have left out because of age, economic status, identity, and geography. With only 20 months left to achieve the MDGs, we have to accelerate our progress, increase access to essential information, services, and commodities, reach the most marginalized, disadvantaged, and underserved population, dismantle the barriers that obstruct their access. For these are the drivers of the stark contrast and in maternal and newborn health outcomes of rich as compared to poor countries that contrast, and that contrast is intolerable. The evidence is clear. With the right investment in the right interventions, we can achieve the MDGs for women and newborn. And the roadmap has those estimates clearly laid out and the countries where they matter most. So we are working with those countries. Later this month, in this July, we're actually having a workshop in Addis Ababa to take this further. So, incontrovertible with evidence that investing in additional investments provide these solutions, and we want you to continue to work with us and ensure that as we take this forth, and as we reach more women and girls and babies, that we can actually approximate or reach the MDGs in those countries. Now, but I think that is not enough, because what this tells us is that if we make concerted efforts as organizations within the United Nations and working together with other partners in the field of development, civil society, the private sector, and governments in the world, we can actually make sure that the post-2015 development space identifies and focuses on people, especially women and girls, adolescent girls particularly, at the center of human development. It is not just the right thing to do, it's the most sensible thing to do. I thank you very much.
Thank you so much, Professor. Well, as we know and as we keep hearing, we are in a transition period now as we try to both accelerate progress towards the MDGs and also do our best to ensure that women and children are at the center of the development agenda and a framework beyond that. But what are our key priorities in seeking to bridge these two areas? And our next speaker is going to answer that, and she's the Special Envoy of the President of the Republic of Indonesia on the Millennium Development Goals, and that's Professor Naila Muluk.
Excellencies, distinguished guests, ladies and gentlemen, as has been much emphasized by a lot of speakers since the first day of this meeting, I'm sure we are all aware that we have arrived at a critical juncture of our effort to fulfill our commitment of improving maternal and child health across the world. Now it is just roughly a year to go before we reach the deadline for the MDGs. At the same time, we find ourselves in the middle of the most hectic period of putting together the post-2015 development agenda to succeed the MDGs. Given the critical time we are facing, this Partnerships Forum is extremely important because it provides us with a unique opportunity to examine what we have achieved so far, what challenges remain to address, and what opportunities that we have to explore and utilize for the benefit of maternal and child health in many countries of the world. The world we face today is quite different from the one we saw in 2000 when the MDGs were first adopted. The world has become richer, but we have more uncertainty than before. Though a lot of progress has been made in the MDGs so far, we are still confronted with disparities between different social groups, between urban and rural setting, between gender group. In addition, socioeconomic inequalities have not been adequately addressed in many parts of the world. Since 2000, we have made mass progress in many areas of human development, including women's and children's health. However, at the same time, we are witnessing huge challenges still to be addressed in these particular areas toward the deadline of the MDGs and beyond. We are becoming increasingly aware that women's and children's health is not an independent or isolated entity separated from other human development areas. Many factors outside the health sector remain important determinants in ensuring women's and children's health. Issue of infrastructure, access to safe drinking water and sanitation, education, included girl education, inequality of opportunities still need to be addressed in the post-MDGs era, and we should put greater focus of them if we are to deliver better health and development for women and children. Again, this view has been shared and articulated in one way or another by many of the speakers in this forum. As we look back at our experiences during the MDGs era, we realize that every country, every region, every locality has its own problems, challenges, and opportunities. In addition to the different contexts, we have different resources, different capacities, and different points of departure in dealing with the problem of maternal and child health. This is why progress in maternal and child health has been uneven between countries, between regions, and even between districts within a province, as shown in Indonesia. Our experience in Indonesia also reinforced the importance of integrating various development sectors into the health sector itself in improving maternal and child health. It is impossible to make meaningful progress in maternal and child health if the issue of infrastructure, education, access to safe drinking water, and basic sanitation are not adequately addressed. MDGs will be an unfinished business, and maternal and child health must remain at the center of our new development plan. But in order to sustain gains in this area, we need also to address issue of malnutrition, food security, and non-communicable diseases in a holistic approach through multi-sectoral partnership. Therefore, working in silo is no longer a viable course of action. We are also confident that working in close and sustainable partnership between the government and the non-state actors, particularly civil society and private sector, is crucial in helping improve maternal and child health, particularly in the post-MDGs era. We delight a growing awareness of the importance of this modality among development stakeholders. Finally, we would like to see how we can develop further a close and sustainable partnership in our collective effort to promote maternal and child health that the best suits our own condition and circumstances. May I say thank you to Carol and Madame Gracia Marshall. MDGs will be unfinished business by 2015, and maternal and child health should remain our top priority for the post-2015 agenda. Thank you.
Sorry. Thank you so much, Professor Malak. We do have 2 to 3 more speakers to get through, so I'm going to try and speed us along somewhat. We heard yesterday from Margaret Chan, a challenge was put to everyone, and that was for us to support national leadership. I now invite Professor Onyebuchi Chukwu, the Minister of Health of Nigeria, on stage to speak to us about the importance of country leadership as an important key to success. Professor, and a round of applause for him, please.
Thank you very much, Nikiwe. I'm a soccer for excellence, and I think you're exhibiting that here. Well done. Excellencies, distinguished ladies and gentlemen, this is the only opportunity I have to speak at plenary, so I guess one of the reasons I must have been called upon is that today I chair the AU Ministers of Health, so I will speak for all ministers as it were. So let me thank all the partners, the co-hosts of this event. This has been wonderful. The government of South Africa, and I see here that my brother, the Minister of Health of South Africa, is representing government here. So thank you, Aaron, for what you and your team has done. Of course, countdown to 2015, promise renewed, and the independent expert review group. I thank all of you. Of course, I'm on the board of the partnership, so they will be the last. The partnership for maternal, newborn, and child health, with the able leadership of Mrs. Gracia Machel, Your Excellency. Thank you so much. Your speech yesterday moved all of us. Thank you very much. And of course, the Chief Executive, very own Carol Prison, and members of the Secretariat. Well, is there any other thing you haven't heard, except to hear from a serving Minister of Health? We should be congratulating ourselves as the global community. It's actually time to celebrate, but that should not get us to develop swelling heads. We still have much to do, but I think first we must understand that we are doing well. It's possible that the pessimists didn't see that the Millennium Declaration was going to work. And now that we've succeeded with the MDGs in a way, everyone now wants to come on board. Success will always have several parents. Failure, nobody prays for failure because it's all about being orphaned. And of course, even our vocabulary has grown. Now we talk about unfinished business. Like Aaron told us yesterday, this business will not finish until the human race disappears. So Aaron, you're right. It will always remain unfinished business until we drive all the indicators to zero. We now talk about multi-sectoral collaboration. Some people don't like the phrase, but of course that's the reality. It's the reality. It has to be multi-sectoral. What are the good lessons we're taking up? One is that it is possible to have one government for the world without taking away the sovereignty of any nation. That's what we've done. Now we've set agenda for countries that is not dependent on the party that won the election. This is wonderful. One can't believe it's happening now. Now we're talking about resource. Rather than just input, we speak more about performance. Yes, we're talking about one plan, one budget, one M&E. I'll return to this, but very good concept. Now we've developed scorecards. We've gone back to primary school, and nobody wants his or her own score to be below average. That's accountability. Well done. Now we are talking about continuity. Were it not for MDGs, it's possible that when I came on board as minister, Dr. Oshotime, I may have changed everything you started. So continuity, stability, this is what we've seen. Those who feel health is being left out, it's not true. Now the world is so focused on health. I just recall that it was just in August last year, we were here in South Africa, discussing what? Maternal, newborn, and child health. We seem to have forgotten. Less than a year ago, we were here. And of course, more funding, more resources coming into health. There are new policies, there are new laws in every country. Just this afternoon, I almost wanted to take 3 bottles of champagne. Why? because the National Health Bill in Nigeria has now been passed by both chambers of the National Assembly. And you know what? Mr. President said this time around, he's going to sign. So I'm a happy person. Don't be jealous. But what are those things that I think we can still do better? We should still resist having too many vertical programs. We should resist vertical programs. Whatever we are saying, there's nothing new. We can work within what we've built. We should only do things better. We should only do things better. For ministers, find a way of reducing the number of meetings we have to attend. We need time also to implement. I believe the technical people, you can do the work, let us know. And sometimes, if we have too many meetings for ministers, it tends to increase the administrative cost. We should also try to put a lid on the administrative cost. I think we should also avoid the temptation of putting too much emphasis on the correctness of process. Because sometimes, looking at those processes, sometimes we think that's the work. That's not the work. The process is supposed to measure your work. We have to be very careful. Yes, national ownership and leadership. That is something I said I'll return to. How far have we done in terms of ensuring national leadership? Are we paying lip service? We are not paying lip service, but I think we can do a lot more to improve the system. We can only define the general trend. We cannot prescribe the same medicine for everyone. In any case, even in pharmacy, for the same disease, there's something called dosage. And there are contraindications. There are drugs you don't give to pregnant women. So I think one of the things we need to do is to seriously go on this one budget. How ready are we? In Nigeria, we're almost finishing the work. It has taken me 4 years to get to that, but we'll get to it. Now we've assembled a template with all our partners. I will know what you are doing, you should know what I'm doing. So there's no duplication. We should hold ourselves accountable. That's what mutual accountability is all about. We're almost through now. We've gotten a software, people are looking at it, and very soon we'll launch it. I think those are some of the best practices that one is seeing because of our collective effort. Nobody should go to any country and try to impose, but you should suggest and lead. We need to think about sustainability. Many times, there's no African problem, there's no Asian problem or European problem. It's the problem of humanity. And I say with all sense of responsibility. And I believe the good leaders in Africa are not necessarily crying for any aid. What they are asking for is partnership. There's a difference. Partnership because you have something to contribute. Some people are lucky they can contribute money. But money is not all. The other things we cannot contribute. And in any case, the whole world is contributing to the other. Each one is getting something from the neighbor. We need to look at those sectors that are now feeling left out because of the success of the NDGs. They are important. We need to look at countries that feel they've been left out because we've not quite addressed their own problem. There's no country without some challenges in the health sector. So we need to make it really universal. It's not only for the developing countries. We should also support our brothers and sisters living in developed countries to also see how we can improve their own health system. They may not have the challenges that are peculiar in some developing countries, but they do have their own. Sometimes we forget that. Collaboration should continue. Yes, we've talked about South-South. We should learn from each other. We should see how we can support each other. We should leave out the competition, but competition is also good. It's part of life, but what we're talking about is the healthy competition. Now, is there a difference between health and health services? I think so. I think so. I'm Minister of Health, but I'm not annoyed when there's increased funding for water. I'm not annoyed when there's increased funding for education. I don't frown when there's increased funding for sanitation. What we should be addressing is just the needs of the people. It doesn't matter which sector that is doing it. We should support each other. There's a difference. Actually, I should be called Minister of Health Services because health is beyond me, actually. I say it because I know that even what is happening even in Nigeria and some other parts of the world, what we call terrorism, conflicts, and so on, is affecting what we are doing even under the partnership. We've all said here, girl-child education is important. And yet, where schoolgirls are being kidnapped, I don't know how that is impacting on us. But that is not Minister of Health's responsibility. Finally, it is not just about existence and death. What is in between? Quality of life. Moving forward, I think we should also begin to look at the quality of life. Thank you. Well done.
Thank you so much, Minister. Well, next up we'll hear from Dr. Flavia Bustrio, Assistant Director General, Family, Women's and Community Health at the World Health Organization. As we heard, one of the recurring themes has been the need to work together for a healthier future for women and children. But how do we hold all these varied groups accountable to ensure that there's progress? Dr. Bustrio, thank you.
Thank you very much, Nikki, and good evening. Such a journey, this partnership forum, and especially the closing session. Mama Michelle, when we were working to launch this partnership in 2005, almost 10 years ago, we could not envisage that it would take this high that you now have in your hands. We could not envisage that we would have more than 600 partners. We started from 70. We could not envisage that there would be a youth consistency so vibrant. This forum for me will be the youth forum. That's what I will remember. I want to say, I was interviewed by many journalists here in Johannesburg. The best interview was by a future journalist. She was 14 years old. I don't know if she's still in the audience, Veronica. Your question was the sharpest one, and really I will forever remember them. Please give her an applause to those group of young journalists because they were fantastic. I think if I reflect on your question, Nikki, and on where we are, it's very clear that we have made a tremendous progress, especially in improving health of women and children. And one key ingredient of that progress has been the accountability, has been the focus that we have had on tracking the results, on tracking the resources, on sharing with each other where the progress is, and also on blaming and shaming, which has happened especially since we have created and instituted this group called the Independent Expert Review Group. I want to thank them because sometimes people criticize, but that's how we envisage that their role would be, that they would reflect the picture, and sometimes the picture is not the pretty picture that we would like to have. So when I reflect about what we have achieved in these many years and what we have achieved in these 2 days, I think what united us 10 years ago was really to give an acceleration to those 2 Millennium Development Goals, 4 and 5, that in 2005 were lagging. There was no progress. Many countries actually had seen increase in maternal and child deaths. And what I feel in these 2 days, that sense of unitedness, that convergence on a vision that the job is not done yet, and we need to continue to drive a vision of ending preventable maternal, newborn, and child deaths, and including in that vision ensuring universal access to reproductive health. I think that unitedness is with us and will be a great strength for the days to come. On behalf of Ms. Michelle, the chair, on my behalf as the co-chair of the partnership, and on behalf of all the colleagues that are still here at 7 p.m., I'd like to thank especially Carol, but also all the Secretariat team, because such events are a tremendous strain, and I know for first-hand experience. So please give a round of applause to all the people and the colleagues that have worked for this. Well done. This was great success. I know people didn't sleep on it. One final thought. The Deputy President of the Republic of South Africa really struck a chord with me when he mentioned a very well-known quote from Mr. Mandela that I cherish very much. He said, and I quote, "There is no other way for a society to understand the soul of the society than the way that it treats its children." And what struck me, he said, this partnership reveals the soul of the society. And I think this forum has truly done that brilliantly. We have revealed the soul of the society, and by doing that, we have achieved what is in that logo. We will accelerate progress in these last 500 days, and we have together envisioned the future. Thank you very much. Thank you, Mama Michelle.
Thank you so much, Dr. Bestray. And finally, this evening now, I'd like to call on the Minister of Health of South Africa, Dr. Aaron Motsoaledi, to give us his closing remarks.
Thank you, Nikiwe, Mama Grasa Machel, Chair of Partnership for Maternal, Newborn and Child Health, and your board members, ministers and deputy ministers, heads and representatives of UN agencies, heads of delegations, development partners, ladies and gentlemen, distinguished guests. A very good evening to you. In 2012, ministers of finance around developing countries were invited to Harvard University to discuss the concept of universal health coverage. They were asked to name the core functions and the aim of objectives of ministers of finance. Of course, they spoke about facilitating economic growth, setting up and determining macroeconomic fundamentals for their countries. And of course, they also spoke about all the big ideas about economies of nations and the world economy, which may confuse many of us here today. They were then asked to name any country, any on this planet, which has been able to achieve that economic growth with a sick and dying population. So if you haven't noticed, we gathered here for 2 days, not to talk about health only, as we might be tempted, but about the actual development of nations. Yes, I don't think it's an exaggeration to claim that the fate of women and children will eventually determine the final destinies of many nations. We have had 2 days of very intense discussions on maternal, newborn, and child health. We have witnessed the launch of 2 very important documents, the Every Newborn Action Plan and the Global Countdown to 2015. Now, it is time to accelerate action. During the last 2 days, we had experiences from many countries on what we are doing and what we can do to further strengthen maternal, newborn, and child health and to decrease mortality. It is clear that there are many exciting initiatives that we can learn from and that must be scaled up to reach maximum coverage and impact. This forum has taken place at a very important time in the countdown to 2015. As we heard, there are 500 days before the deadline. We must use this time as efficiently and effectively as possible to ensure that we either meet targets set for each country or get as close as possible. Every time journalists ask me, Minister, is South Africa going to reach the MDGs? I keep on telling them that it's not yet 2015. I'll answer that question at the end, whether we have reached them or not. There is still time. Even if there are 24 hours left, we can still do something. the task that lies ahead towards 2015 and beyond, as Mama Michelle has reminded us yesterday, is to focus on three things, as she said. One is implementation. Two is implementation. And three is implementation. And as the Deputy President of South Africa remarked, partnerships across all sectors of society are critical to ensure that we work together to achieve the targets that we have collectively adopted. Achieving the MDGs is everybody's business. Thinking beyond 2015, it is critical that we work together to ensure that the health agenda is central to the post-2015 agenda, and that is part of the health, as part of the health agenda, women and children are prioritized. As I've said when I introduced the Deputy President yesterday, a fact which was emphasized here by Professor Chuku, is that there can be no time in human history when women don't bring life into this world. We all acknowledge that as sacred. Certainly, South Africa will work hard to ensure that the 2015 agenda includes health. In the meantime, let us work together to ensure that as many of us as possible meet these MDG targets. But to be meaningful, the post-2015 agenda on health should include three issues. And I'm happy that there is already consensus within certain blocs around the world. Certainly, there is consensus in BRICS. I know there is consensus in the AU, African Union Ministers of Health, which Professor Chuk is chairing. There is consensus in the World Health Organization African region that three issues need to be taken forward as post-2015 Health Millennium Development Goals. The first one is that MDG 4, 5, and 6 have to continue. The second one is that we need to deal with the ever-exploding pandemics of non-communicable diseases that are diseases of lifestyle. And the third one is that we need to push the world towards attainment of universal health coverage, meaning that equitable health financing system that, in the words of Dr. Margaret Chan, the Director General of the World Organization, is an equalizer between the rich and the poor within every nation. In conclusion, allow me, on behalf of the government and the people of South Africa, to thank you, Mama Michelle, to thank your board members, to thank the UN agencies, to thank the development partners, to thank all the collaborators, and to thank ministers and deputy ministers, as well as some heads of state for having left their very important state functions to be with us here today. When I mentioned the issue of state functions, I remember attending an African Union meeting where Yvonne Shaka and the then chairperson of the Social Commission of the African Union, Advocate Gawanas, as two women, went to confront heads of states about this issue of maternal and child mortality. And one head of state said, "We are here talking about very important matters of state, and you want us to talk about breastfeeding." And he was told that, "Mr. President, if your mother was not around to breastfeed you, you wouldn't have this opportunity to talk about important matters of state. You might not have been." And so it's very important. So I wish also to thank the speakers of various sections, and most importantly, thank each and every delegate who attended and participated in this forum, I'm sure that we are all richer for this experience, and that each one of us will rededicate ourselves to serve women, newborns, and children, to ensure that they are able to meet their full potential for the development of our world. I thank you.
Thank you so much, Minister Dr. Aaron Motsoaledi. And that brings to an end our official program. I'd just like to thank all of our panelists this evening. A warm round of applause for them, ladies and gentlemen. Warm thanks to all of you for braving the evening and staying with us for this final plenary. We appreciate your participation and eagerness tonight. Thank you so much. So safe travels to everyone, and thank you. Just a quick reminder from the organizers to please leave the translating kits on your desk if you had been using them as well. Good night and take care.